abdominal aorta and its branches. Okay? So abdominal aorta, it's a continuation of which vessel? Abdominal aorta.
Yes.
It's a continuation of thoracic aorta, exactly. And it starts off at the level of T12 to L1. It passes through the diaphragm, through the aortic hiatus, and it gives off all these branches. And I apologize for the words, but this is a mnemonic, and this is how mnemonics work, right? With strong words. So, prostitutes cause sagging, swollen red testicles, living in sin, for men, of course. Okay, so we're just going to follow each branch. So, P for phrenic artery, which will supply what? Diaphragm, exactly. And then C for celiac trunk, which Stelios will explain in just a moment, all the branches. And then sagging for suprarenal, which is paired. And then S again for superior mesenteric, which Ekena will explain in just a moment. And then red for renal, which is paired. And then testicles for testicular artery or ovarian artery in female. And there's a catch here, because if we talk about inferior vena cava here, which runs parallel, the left testicular or ovarian vein drain into the left renal vein, which is different than the right side.
Yeah.
The right side, they drain into the inferior vena cava itself, which is different from the abdominal aorta, right? So just remember this left side trick. Okay, then if we continue, so leaving for lumbar arteries, and then in for inferior mesenteric, which Ekena will also explain, and then sin for sacral, median sacral. And then this bifurcates at which level?
L4.
L4, exactly. So bifurcates at the L4 to the common iliac arteries. Now just these three main branches, they supply organs which originate in three different places. I don't know if you started embryology already, and but you have to know at least these names for the final exam. It's important. So remember, foregut, the organs originating from it are supplied by celiac trunk, midgut from superior mesenteric artery, and hindgut, organs from supplied by inferior mesenteric artery. Okay? So foregut, midgut, and hindgut. And now Stelios will explain the celiac trunk branches.
Okay, so the celiac trunk is going to come out on the anterior side of the abdominal aorta at the lower border of T12, and it's going to supply which organs?
Stomach, spleen.
From foregut. Okay? Organs from foregut. Okay, now, while it's coming out, it's going to split directly into three arteries, okay? That's why we draw it like this. It splits directly to three arteries. The left gastric, the splenic, and the common hepatic, okay? I'm going to start with the shortest branch of the celiac trunk. So the shortest branch is the left gastric. It's going to go to the left and come back on the lesser curvature of the stomach. And it's going to stop on the halfway. It's going to anastomose with the right gastric, which I will explain later. It will also give esophageal artery, which is going to supply the lower part of the esophagus coming below the diaphragm through the esophageal hiatus. That's the left gastric, the shortest branch. Now the splenic artery is the longest branch. Do you know why? Because it has to go all the way to the spleen, which is far away. Okay, so the splenic artery is going to go to the spleen, and on its way, it's going to give pancreatic branches to supply the pancreas. And the biggest branch that supplies the pancreas is called artery pancreatica magna. Okay? Artery pancreatica magna. It will also give short gastric branches that will supply the fundus of the stomach. And the last branch is the left gastroepiploic. Epiploic means omentum in Greek, which is going to come on the left side of the greater curvature of the stomach, halfway, and it's going to anastomose with the right gastroepiploic, which I will talk about later. Now, the third branch is called the common hepatic artery, which is going to go all the way to the liver, and on its way, it's going to give two branches. After giving off two branches, it's going to change its name to hepatic proper artery, okay? So, hepatic proper artery, common hepatic artery. On the hilum of the hepatic proper. On the hilum of the liver, it's going to split into two branches, the right and the left and the right branches. And the right branch is going to give also the cystic artery, which is going to supply the gallbladder. The second branch is the right gastric artery. It's going to come on the lesser curvature of the stomach on the right side and anastomose with the left gastric, the shorter branch, which we discussed before. And the first branch is called the gastroduodenal. It's going to supply duodenum and the stomach, and it's going to come down and split into two. On the left, it's going to give the rise to right gastroeploic, coming on the greater curvature on the right side and anastomosing with the left gastroeploic from the previous branch we discussed. And on the right, it's going to give the superior pancreatico-duodenal branch, which is going to anastomose with the inferior pancreatico-duodenal branch. Now the inferior pancreatico-duodenal branch is coming from superior mesenteric. And here we have four names: superior anterior, superior posterior, inferior anterior, and inferior posterior. So how do we differentiate them? If we have the pancreas, if the blood is coming from the celiac trunk, we have the superior, and in relationship to the pancreas, we have anterior and posterior. And if the blood is coming from superior mesenteric, we have the inferior, and then relationship to the pancreas, we have anterior and posterior. Okay, that's easy. And then,
Can you really explain?
I'm going to talk about superior mesenteric artery and inferior mesenteric artery, right? So, superior mesenteric artery arises from L1 and supplies organs that come from the midgut. So, which organs are these? We have the small intestines, right? So, okay, you can see superior mesenteric, inferior mesenteric, right? So, intestines, we have branches for the intestines. We have a branch for the ascending colon, right colic. We have a branch for the transverse colon, middle colic, and we have a branch for the cecum and appendix, ileocolic, right? So now, inferior mesenteric artery arises at L3, and it supplies organs of the hindgut. Can you guys see? Okay. So which organs are these? Descending and transverse colon. That's one artery, left colon, right? We have the sigmoid. We have sigmoid branches, and we have the rectum, superior rectal artery. Yeah? Good. So, important point, which is what they asked me in my dissection exam, is the fact that superior mesenteric and inferior mesenteric meet. Good. You remember. So, this point has a specific name. This name is magna hilary. Now, inferior mesenteric anastomoses with itself, and this point is called Sudex anastomosis. Yeah, these are 2 points which...
What's that? In repeat?
Okay, yeah, again.
Sudex anastomosis.
Yes, so superior mesenteric and inferior mesenteric meet. They join together, anastomose, and this point is called magna hilary. Yeah? And inferior mesenteric, it runs and it meets with itself. And this point where they meet is Sudex. Yeah?
These are the two branches that anastomose together.
If you want to be more specific, the inferior mesenteric is sigmoid and superior rectal. Yeah? So it's called Sudex anastomosis. Yeah? So,
Do you have any questions?
any questions? Any...
Remember this.